Malaria is a life-threatening disease caused by Plasmodium parasites, transmitted through bites of infected female Anopheles mosquitoes. This disease is rampant in tropical and subtropical regions, especially in parts of Africa, Asia, and South America. Let's talk about the causative agent. 5 species of Plasmodium cause malaria in humans. Plasmodium falciparum, the most severe, Plasmodium vivax, which can remain dormant in the liver, Plasmodium ovale, Plasmodium malaria, and Plasmodium knowlesi, found in Southeast Asia. Anopheles mosquitoes are primarily active at dusk and dawn. They tend to bite during nighttime, when it is cooler and darker. After the bite, a small red bump may appear, which can be itchy. Anopheles mosquitoes prefer clean, still water for breeding. Malaria can also spread through blood transfusions, organ transplants, contaminated needles, and from mother to child. Now let's get into the pathogenesis. When an infected mosquito bites, Plasmodium sporozoites enter the bloodstream and travel to the liver to multiply. After maturing, they re-enter the bloodstream, infecting red blood cells, causing them to burst and release more parasites. This cycle leads to the hallmark symptoms of malaria. Symptoms usually appear 10 days to 4 weeks after infection. Common symptoms include fever with chills, headache, muscle and joint pain, fatigue, sweating, nausea, vomiting, anemia, jaundice, and an enlarged spleen. Severe malaria, often caused by Plasmodium falciparum, can lead to cerebral malaria, severe anemia, organ failure, respiratory distress, and shock. Diagnosis is key. The gold standard is a microscopic examination of blood smears, but rapid diagnostic tests and PCR are also used. Treatment depends on the species of Plasmodium and the severity of the disease. First-line treatments for uncomplicated malaria include chloroquine or artemisinin-based combination therapies. For severe malaria, treatment often starts with intravenous artesunate. Drug resistance is a concern, especially with Plasmodium falciparum. Prevention is crucial. Use insecticide-treated bed nets, indoor residual spraying, and anti-malarial prophylaxis if you're traveling to endemic areas. Prevent mosquito bites by using repellents, wearing long-sleeved clothing, and sleeping under nets. A malaria vaccine, Mosquito, is in use in some African countries, providing partial protection against Plasmodium falciparum. Untreated malaria can lead to severe complications like cerebral malaria, severe anemia, organ failure, hypoglycemia, and even death. Some genetic conditions like sickle cell trait, thalassemia, and glucose 6-phosphate dehydrogenase (G6PD) deficiency can offer partial resistance to malaria infection. Malaria poses significant risks to pregnant women, including severe anemia, premature delivery, low birth weight, and stillbirth. Pregnant women in endemic areas often receive preventive anti-malarial treatments. Malaria remains a preventable and treatable disease with proper interventions, but ongoing efforts are required to reduce its global burden. Stay informed and stay safe. Catch you in the next video.